Good morning, friends. This talk is on molecular therapeutics. From 2019 to 2026, in this last 7 years, we have come a long way into molecular therapeutics, and today it is an established subsystem of orthopedics and musculoskeletal disorders. Numerous orthopedic surgeons are regularly using molecular therapeutics in musculoskeletal care, and in a way, it would not be incorrect to say that these molecules are transforming healthcare through innovation. I am Al Prakash, the founder president of Indian Academy of Orthopedic Surgeons. I have donned a lot of hats. I was an Ilizarov surgeon, then I was an orthoplasty surgeon, then I was a revision orthoplasty surgeon. Since COVID times, I was more interested in developing something less invasive, preserving joints, and that is how I stumbled into molecular therapeutics. I would owe a great thanks to Dr. Prashant Shah, who introduced me to Ozone, and then on we went into molecular therapeutics. Let us start with a simple example. This is Dr. Prashant Shah's case, an osteoporotic fracture with a gross arthritis of the knee. These days, this patient would get even a more punishing treatment in the form of a mega prosthesis replacement, but in those days of AO fixation, this is what is done for the patient, and you can see the two incisions and the staples on both sides, medial and lateral. However, the entire anterior skin broke off, died, and this was a patient in 3 weeks' time. Of course, the 5 or 6 surgeons that the patient met all advised amputation. Now, a fracture fixation leading to an amputation is one of the biggest disasters that one can imagine, and fortunately, this patient could get correct treatment, ozone bagging, ozone injection, ozonated saline dressings, infection control, then removal of the plates, replace with a locking nail and full thickness myocutaneous graft, and after a period of 6 weeks, bone also united fully and the skin also united fully. At least the patient saved the limb. Another case, this is my case, was referred to me by an orthopedic colleague, and we can read the messages. So this was a 6-month or 8-month calcaneal sore in a chronic renal failure, on peritoneal dialysis, and one place he was advised amputation just above ankle, and another place they advised bone cement with antibiotic, followed by a flap cover. All I did was inject ozone around the periphery of the wound and give him ozonated glycerin dressing. You can see within a week, and then in 3 weeks you can see what the wound was, how deep the ulcer was, and how it has healed. This is a case sent to me by one of my colleagues. Bad, fungating, foul smelling wound on the sole of the foot, and after just 1 or 2 sessions of ozone, you can see the healing. The white becomes pink, and there it is within 3 weeks. which went on to complete normal healing. The next patient, human papillomavirus with warts. This was a young lady who had this condition, was referred to Germany for some laser treatment for wart removal, and they said that she will test HPV positive for the rest of her life. We just did vaginal ozone one session and one extracorporeal blood oxygen ozonization, and everything cleared off. The case sent to me by my colleague, buccal cancer leukoplakia. Here you can see the image on the left of my face, almost going up to the tooth. He was just treated with ozonated glycerine pads kept under the buccal area, and within 20 days you can see the regression of the cancer. He was of course asked to completely stop the tobacco products which was causing him the problem. Such bone deep metatarsal head visible diabetic ulcers normally undergo a midfoot amputation. This patient already had a ray amputation, but our colleague Deepak Sahotra managed to salvage this, and from the picture on the left of my face to the one on the right of my face, you can see the wound is completely healed and normal. Another gentleman, a farmer, diabetes, one ray amputated, and because he has to work in the fields, no special footwear can be given, entirely treated with ozone. You can see from the left to right, non-healing for 1.5 to 2 years, healed, and follow-up after a period. That's a case of yours, not a common case, treated by my friend Dr. Deependra from Nepal, Kathmandu, and we can see the final outcome: scraping, bagging, injection of ozone around the periphery of the wounds, ozonated glycerine, and hematogenous glycerine, ozone. And of course, the hottest subject of today, which is avascular necrosis of the femoral head, both because of the COVID disorder, COVID disease, and more because of the COVID vaccine. We are seeing a pandemic of avascular necrosis of femoral head in the younger patients, and you can see the picture on the left is a near collapsed FICAD grade 4 head. No core decompression was done. He just had a couple of MASTs, then he had an EBU, and he was on Mukherjee regime for 18 months. Joint space is maintained, head ferocity is maintained, and the head recovers to normal. Again, you can see on the left and the right an almost punched out head about to die and collapse, and the X-ray on the right shows how the joint space is maintained. Head has not collapsed, head has recovered and looks near normal, and in another year or two this head is going to become as good as new. Post chemo, post radio malignancy patients do very well on EBU. The gentleman here is a professor of medicine with hepatobiliary pancreatic duct adenocarcinoma, who had come to me with about 4 liters of ascites, which was removed, and then he received a EBU. You can see the blood which is going in and the blood which is coming out are two different colors. It is almost like venous blood which is drawn from the donor side and a bright red arterial blood that goes into the recipient side. After one, you can see the gentleman is, in the first video before we saw that he was completely bald. During the second session, his hair has started growing. And this is what he has to say about the treatment and therapy. Now you can tell. You can speak. Good.
I myself, Professor Dr. Ozone Chaudhary, MD Medicine, have taken Ibu from Dr. L. Dr. L. Prakash after chemo of pancreatic ductal adenocarcinoma. After that, the side effect of chemo dramatically reduced, and all hair grow well, scalp hair, and all side effects like pains, cramps, reduce, and ascites was at that time. Now ascites gone away after triple CT scan. There were no ascites at all.
Excellent. Unfortunately, Dr. Praveen Chaudhary, my close friend and the professor, passed away last month. But he had survived for 3 or 4 fruitful years after meeting me, and he died without pain. Molecular Therapeutics thus produces real, wonderful and quantifiable results in a wide variety of cases. Things like pain relief, improved function, enhanced immunity, rebalancing the disbalanced metabolism, superior augmented healing with measurable, reproducible, teachable procedures and investigational difference which can be documented. So now 4 questions come to our mind. What are these molecules? How do we procure these molecules? How do these act? And how are they administered? These are not pharmaceuticals for which we need to have prescription to buy from a medical store, nor they need to be certified by CDSCO, because they are not packaged goods, they are not drugs. They are inherently available molecules. The 2 commonly used molecules are O3 or triatomic oxygen, also known as ozone, and H2 or molecular hydrogen. So, what is ozone? Normally, oxygen O2 becomes a stable molecule. If an additional singlet tags on, it becomes O3. And the single O or singlet is an unstable molecule which hungrily goes out. It detaches from the O to the 2 molecules and goes out in search of a partner, and in this process it oxidizes whatever it meets in its path. Ozone is a naturally occurring product but comes occasionally. Ozone is produced naturally when lightning strikes or when fresh rains come or at high altitudes, or when waterfalls and sunlight join. And of course, above our Earth, just at the stratosphere, there is an ozone layer that protects the whole Earth from the toxic and harmful radiation by absorbing them. Commonest way in which ozone is produced, and this is also the way in which it is produced in the generator that we use for making ozone, is by striking of lightning. Ozone has a trinodal action and acts in three different ways. I will explain all the three different ways to you shortly. This is a famous scene from Bahubali where we see him shoot 3 arrows hitting 3 targets simultaneously. And ozone exactly works in this way. The first action is antimicrobial. It's a very powerful antimicrobial and works against all bacteria, fungi, virus, parasites, inclusion bodies. So, from COVID-19 to methicillin resistant, MRSA, all bacteria, virus and fungus and parasites are killed by ozone. It is far more powerful than other oxidants. H2O2 or hydrogen peroxide works by H2O by dissociating into H2O and O. Bleaching powder CaClO3 works by dissociating into CaClO2 plus O. That singlet produced by them oxidizes and cleans everything. So we use a chlorine bleach for purifying our well water, we use hydrogen peroxide for cleaning the wounds. But ozone is 24 times more powerful than hydrogen peroxide and 16 times more powerful than chlorine bleach. So it is rightly said that when all antibiotics fail, ozone comes to our rescue. Ozone is a wonderful immune modulator and is the first DMARD to be considered for all autoimmune disorders. This is very, very important. The third action of ozone. Ozone is an oxidant and in a precise controlled doses in which we administer it therapeutically, there is an antioxidant cascade. So this stimulates body's antioxidants. And what does it lead to? It stimulates superperoxide dismutase, it stimulates catalase, liver produces glutathione peroxidase, innate glutathione is produced, NRF2 alpha is produced, there is huge surge in TNF alpha 1 secretion. So all these things put together, which are antioxidants, help us to clear the body of pollutants, which means the increase in superperoxide dismutase, massive increase in glutathione peroxidase, and stimulation of secretion of other antioxidant enzymes from the liver has a broader detoxification effect, and this lasts for or continues for about 3 to 4 weeks, meaning after a single session of MHT or IBU by ozone, the antioxidant effect produced by the supposed oxidant in itself keeps detoxifying our body for a period of 3 to 5 weeks. As per the new IOS protocol, we also give a redox drip, meaning hydrogen infused drip with vitamin C B complex, B12, N-acetylcysteine, other things, immediately after the ozone to augment this antioxidant effect and keep it active for up to 3 months. The last powerful action of ozone, which is very useful for orthopedic surgeons, is it is a very, very good local analgesic, local anti-inflammatory, and local pain relieving analgesic molecule which produces excellent results whether injected subcutaneously or even subcutaneously, intraarticularly or into intradiscally or any other place. As per the modes of administration of ozone, except for inhalation, because ozone is toxic to the lung mucosa and is very irritating, we can administer ozone by all the routes: subcutaneous, intravenous, intraarticular, paravertebral, epidural, intradiscal, topical. We can infuse ozonated saline. We can use autohemotherapy, major autohemotherapy, where we drop blood into a vacutainer bottle and put it back through the same vein. Rectal insufflation, vaginal insufflation, and of course, the king of it all, EBU, extracorporeal blood oxygen ozonization. Here you can see an old man with a road traffic accident. This was sent to us in the group only 3 days back. He had a head injury, he had multiple rib contusions, rib fractures, and the eyelids were so swollen that he was not even able to see. Using a short 26G needle, 100 micrograms per ml of ozone was injected both upper and lower eyelids, just subcutaneously, and within half an hour you can see the results on the right. In a similar manner, this is a patient with an intra-articular Schatzker 6 fracture of the proximal tibia as a result of motorcycle accident, who has come with extreme swelling and an impending compartment syndrome. Such a situation would have warranted an immediate fasciectomy as an emergency treatment. However, the case belongs to one Dr. Ganesh Ankum, who just injected about 150 to 200 ml of 100 microgram ozone into this impending compartment syndrome, into all compartments, and within 24 hours the blisters had disappeared, the swelling had come down, and there was no compartment syndrome. And you can see on day 17, just with a simple 3-ring frame, all wire frame, the fracture is stabilized and maintained. This is a lady with rheumatoid arthritis of the wrist, with hardly any joint space. Immediately after an injection of ozone, the gap has opened and then she is able to move her hands up and down. Ozone induced arthrodiastasis, meaning increasing the joint space by the gaseous arthrodiastasis. These days we use a combination of hydrogen and ozone called hydrozone arthrodiastasis. Is another very useful method, as you can see in both the videos, one on my left and one on my right. So, by injecting a mixture of ozone and hydrogen, a joint space is created, and somehow these gases also stimulate cartilage regeneration, so that the joint space which is created is retained. So this is not a temporary short-term measure, it is a Really long-term measures sometimes last for years. The second molecule we use is hydrogen. Though hydrogen is the most abundant molecule in the universe, it is not existent on the earth. Nevertheless, hydrogen is the most powerful antioxidant known to man. This neutralizes almost all the harmful free radicals. Acting on mitochondrial level, it resettles the rogue mitochondria. It has got a very strong anti-inflammatory effect, very strong effect against the reactive oxidative species, and hydrogen is known to be or proven to be or being studied to be a molecule that supports recovery, vitality and longevity. So, unlike ozone, where we need lot of restrictions and fear to administer in the right way and not to inhale, etc., with hydrogen, any route is good. You can inhale hydrogen. There are many of my patients who have reversed COPD by just inhaling hydrogen in the night, 8 hours every night for as little as 3 to 6 months. My own smoking induced COPD, where every breath I used to have X-ray muscles pulling me, has completely gone. I can now give 1 hour talks without feeling breathless. Intra-articular ozone and hydrogen mix work wonderfully for arthrodiastasis and anti-inflammatory effects. Hydrogen bubbled bath in a bathtub or swimming pool, or even bubbling in a bucket and using hydrogen water for bath makes one very comfortable and happy. Hydrogen bubbled water for drinking is extremely healthy and is one of the must do things for health conscious people. Most sports persons and similar people are seen drinking hydrogen bubbled water. And of course, hydrogenated saline infusion with nutraceuticals, vitamin C, B complex, that improve in energy levels and general wellness. This is a short video of me getting my own hydrogen drip about last week. You can see that over the years I have become healthier. I have got rid of my diabetes, I have got rid of my triple vessel disease, I have got rid of my COPD, and of late you can see me recording and you can see my hair and all. In 2019 my hair was practically white. I have never used hair dye in my life. And 2026, and anyway as you can see me today, my hair is darkening from the roots. You can see me, it's darkening from the roots. Can you see? Here we are. So the hair is actually darkening from the roots. Now the question, how do these molecules act? How do they produce such wonderful results? Unless we unlearn, we cannot relearn. So now comes the important process of unlearning. Let us start with something called mitochondria. In medical college, we have all been taught that mitochondria is a powerhouse of each individual cell. How many of the audience here who are listening to this talk actually know about the mitochondria and its DNA and its genes? How many of you know that mitochondria have their own genes which are different from human genes. Our genes are helical, stranded, separate, linear. Whereas mitochondrial genes are circular. Mitochondria has got 37 genes. These 37 genes are inherited from the X chromosome. And these genes control the essential function of the mitochondria. Meaning, the Indian Negroid and Mongoloid Caucasian persons seen in the background all have very, very different DNA characteristic of them, and no two human beings except for identical twins have got a similar DNA. But on the contrary, every single of these three people share the identical mitochondrial DNA. It is currently postulated that all humans inherit their mitochondria from a single female X chromosome. This female probably evolved in the terrains of Africa on the banks of Nile about 120,000 years ago, and she should be called the mother mitochondria, and the mother X, from whom all of us have descended in some way or the other, with interbreeding with Homo erectus and eventually breeding with Homo sapiens. The mitochondria has arrived into our human body. As per the current theory, mitochondria were once bacteria, because even now there are certain bacteria whose genes very closely resemble the genes of the mitochondria. Way back in the past, when cells were engulfed with mitochondria, it was a tug of war between the mitochondria and the cell. If the cell was strong, it digested the mitochondria and the mitochondria was killed. If the mitochondria was strong, it killed the cell. In this process, somehow, in very rare case, a cell and mitochondria developed symbiotic relationship, live and let live type. So, the cell said, I will provide you the food. Mitochondria said, I will provide you the energy. So, cell supplied the nutrition, mitochondria supplied the energy. Cell thrived, mitochondria thrived, and they lived together happily. And this is the drawing we have been all shown or taught within anatomy and physiology of one cell, one nucleus, one mitochondria. Now, if I use this opportunity for telling you that this is absolutely incorrect, the one cell, one mitochondria theory or story is oversimplification of things and entirely contrary to the truth, because except RBC, which have zero mitochondria, average cell contains minimum of 50 mitochondria, moving up to 80,000 or more mitochondria per cell depending on the requirements of the cell. So, RBC has zero mitochondria, low energy cells will have 50 to 200 mitochondria, cells that need moderate energy will have 1000 to 5000 mitochondria like muscle cells, heart cells may have up to 10,000 mitochondria, neuronal cells which are constantly working may need 80,000 mitochondria per cell. So, we must understand that our body is what our mitochondria is, or in other words, our body behaves in a way the mitochondria makes the cell behave. Because the story doesn't stop here. With evolution, mitochondria increasingly took up roles more than energy. Cell multiplication, cell death, apoptosis, telomere length, general aging, and many subcellular roles. So, mitochondria said, let me help in division of the cell. Let me help in multiplication of the cell. Let me decide how long a telomere will be. Let me tell you when the cell should die. And in another word, let me tell you when the human should die. That much of power the mitochondria got. And we know that power corrupts and absolute power corrupts absolutely. And thus, some mitochondria became rogue. A rogue mitochondria is a mitochondria which starts making its own decisions which may not be in the interest of the organism of the cell in which the mitochondria resides. And this rogue mitochondria can start acting on the organ in which it is situated and produces a plethora of different conditions. For example, if the mitochondria, the pituitaries become rogue, you get satiation issues and dyslipedemia and obesity. If it hits the pancreas, you get diabetes. If it hits the adrenals, you get hypertension. If it hits the ovaries, you get PCOD. If it hits the vascular intima, you get plaques and get heart attacks. If it hits the thyroid, it can cause a hypothyroidism. If it hits the uterus and ovaries, you can get menorrhagia, metromenoresia, polycystic ovarian syndrome, it's all metabolic syndromes. If it hits the fat cells, neurons need a lot of fat cells to survive. Then you get Alzheimer's. So these consequences can be regional or systemic. And a large number of conditions are caused, can be clubbed together by a common root cause and multiple implications like plaques, hypothyroidism, hyperthyroidism, Alzheimer's, Parkinsonism, senile dementia, arthritis, pituitary, obesity, dyslipidemia, diabetes, hypertension, PCOD. Unfortunately, except for arthritis which causes severe pain and makes the patient reach the doctor, or PCOD where some irregularity of periods will make the mother concerned enough to bring to the doctor, all other conditions are silent. Hypertension is silent, diabetes is silent, hypothyroidism is silent, hyperthyroidism is silent, dyslipidemia is silent. These days, because of increased blood investigations, we are able to catch the disorders early. But whether we are able to treat them in the right way or not is not yet ascertained or approved or proved. Molecular therapeutics resets the rogue mitochondria, jolts them and gets them back to action so that the disease is reversed or controlled or stabilized at that stage. I do not mean to imply that you can cure cancers or reverse diabetes in every single patient by using ozone or hydrogen. However, the disease can be made less active, and at least in diabetes, we have reversed a lot of type 1 and type 2 diabetes. A lot of hypertensives have been off medications. We can reduce the load of medications, and in post chemo, post radio malignancy patients, we can reduce the dose of, we can revert the chemotoxicity from the chemotherapeutics and the radiotherapy. Now the question, how do we get ozone or hydrogen to our clinic? You cannot go to a pharmacy and buy a tablet of hydrogen or a bottle of ozone. These molecules have to be manufactured or made by us in our place. And for that we need ozone machines and hydrogen machines. So this is the basic requirement for an ozone machine is just an oxygen cylinder. You need an ozone machine and a dry regulator. Connect the regulator to the cylinder and plug in to the machine. Ozone will be produced. Recurring costs are practically nil, and a full cylinder will last close to 3 months for an orthopedic surgeon with a very busy practice, and for one who is doing leisurely practice it may last up to 6 months or even a year. Hydrogen is produced by PEM, plasma electrolytic separation, wherein distilled water is separated into hydrogen gas and oxygen gas. But the water has to be very pure, TDS free, ozone free, chlorine free and particulate free, so that the filters of the hydrogen machine don't get blocked. Here is a demonstration of how ozone is generated by an ozone generator. You can see that the machine has got switches 1 to 9. The regulator is set at the desired level and ozone is filling up in a syringe. You can use this ozone to inject intra-articular, intradiscal or into the bottle. It smells a little harsh, and then you can see that ozone practically destroys latex. The machine also can produce vacuum when needed. This is a hydrogen machine in operation. Medical distilled water, medical grade pure distilled water is poured into the machine. It's a plug and play system with a touchscreen, LCD, and hydrogen is produced. We can see that you can flame the hydrogen and it needs to be extinguished in water. It bubbles in the water also. So this is how hydrogen and ozone are produced. The next is a very short clip of me undertaking an EBOO procedure. EBOO is nothing but extracorporeal blood oxygen ozonization. Meaning from the donor vein, blood is extracted, goes into a borosilicate glass flask without filters, is ozonated, purified and returned back into your recipient site. The blood that goes out is very dark in color and the blood that comes back is tomato red. You can see the color difference between the outgoing and incoming blood, which I am showing. My donor side blood is venous blood, which is very dark, and the recipient side blood is near to arterial blood. I myself take this procedure regularly. I have reversed my diabetes, I have reversed my COPD, I have improved my health. My sleeping time has increased, my exercise level has increased, I walk 15 kilometers in jungle. My hair has become dark from the roots. And this is something which really helps me. And this brings to the next question. Where do I use molecular therapeutics in my practice? Over a period of time, from operative orthopedics, I have moved on to preventive orthopedics. From illness, I have moved on to wellness. From treating diseases, I have moved on to preventing disorders. And the most important indication where I use this is lifestyle disorders, type 2 diabetes, obesity, dyslipedemia. This is what we eat these days, and a man is what he eats, and he digs his grave with his teeth. So this is what our therapy helps to reverse and make him better. The other thing I use it for is cardiovascular diseases, hypertension, atherosclerosis, heart failure. And we have been able to wean off many people from antihypertensives and have avoided bypasses and stent surgeries advised by cardiologists after angiograms. For an orthopedic surgeon, the power of ozone and hydrogen as autoimmune and inflammatory modulators is profound. Rheumatoid arthritis, lupus, irritable bowel syndrome, psoriasis, all these patients benefit dramatically. The dose of DMARDs gets reduced considerably, and a combination of Mukherjee regime and molecular therapeutics is really wonderful. Neurodegenerative and neurological disorders, Alzheimer's, Parkinson's, multiple sclerosis, all these which were considered as incurable diseases and incurable disorders in the older age in the past have now been shown and proven to be practically reversible or at least stoppable at whatever stage they are in. In oncology, we have targeted therapy and precision. But one thing must be re-emphasized, that essentials of cancer management are surgery, chemotherapy and radiotherapy, all of which are dangerous procedures and have side effects, and molecular therapeutics comes after that as a palliative therapy to reduce the toxic effects of the chemotherapy and radiotherapy, and also to reverse the damages caused by chemo and radio to normal cells in the process of killing the malignant cells. And of course, in infectious diseases, viral infections, chronic infections, antimicrobial resistance, HIV, HPV, we have got fantastic results. I personally have got 4 cases where the HIV patients have been made copies negative. HPV, I have actually cleared 7 or 8 cases. Viral fever, flu, dengue, Guillain-Barré and similar diseases, we can produce outstanding, reproducible, repeatable results at any center across the world. It is said that pictures speak louder than words. So I'll just present 2 examples to conclude my talk. Look at the dates and look at the knee. This lady had bilateral arthritis of knees, could not walk, came in a wheelchair, but would not get knee replacement done because her elder sister had a knee replacement which was infected and the lady was in a wheelchair. So she just had hydrozone arthrodiastasis and Mukherjee regime, both concepts of molecular therapeutics, and that was her knee. After 6 months, I am posting both the x-rays together, both are standing. You can see the patient. In one she is 74 years and the date is in the month of April, another one is in the date of November. So between April and November you can see the characteristic opening of the medial joint space without any medications. Arthrodiastasis without any surgery, only by medications and arthrodiastasis. This one is an Italian lady who had come to Amritsar, fallen down, had a trochanteric fracture, consulted 2 or 3 doctors and was advised DHS by 1 and PFN by 2. She messaged her own doctor in Italy, Dr. Silvestri, who posted on our group and asked if anybody can handle her non-operatively. Fortunately, she was in the same city as Deepak Sahotra, and so she was referred to him and he gave beta 6 block and an MAHT, and that is the patient walking.
Evening, Dr. Prakash.
Such a blessing.
Such a blessing to
know you,
my through my dear Dr. Julia Silvestri that
ask you
ask you
guidance,
for guidance, and you sent me here to Dr. People.
And I'm so
And I'm
blessed,
so
happy.
blessed, so
Look
happy.
at me, I'm
Look at me, I'm standing, I'm already walking.
It's all Waheguru.
It's all Waheguru. It's all the miracle of God. Thank you. Thank you for all your knowledge. Thank you, Dr. Deepak, that is taking such a good care of me. Waheguru. Thank you.
So now this lady walked within 20 minutes after her blocks and MAST, and that's her in a week and in 2 weeks. You can see that she's just carrying her walker. So we don't need DHS or PFN in every single intertrochanteric fracture, and most undisplaced fractures can be treated without surgery. Molecular therapies do hasten fracture healing, as you can see from the videos on the left and the one on the right.
This is better than
Within 45 days, she had reached to
this is better to go
a single stick, and the fracture united in a very, very short while. Pay careful attention to the x-rays. We have the dates. February 3rd, the patient gets an accident, and 24th March, which is less than 6 weeks, the fracture is united with no surgery. And here is a patient at about 8 weeks practicing her calisthenics, 64-year young lady. And you can see how good and how comfortable and happy she is. Can we imagine any DHS patient or any PFN patient doing all this in less than 3 months, no scar, no surgery, no risk? So we come to the conclusion of the talk. What are the take-home messages? Be aware of the rogue mitochondria and their detrimental effect on human body at cellular and immunological level. Master ozone and hydrogen. Master ozone and hydrogen, and you can conquer many unconquerables. All therapists are welcome to join us in the studies, and let us change history and leave footprints on the sands of time. Any orthopedic surgeon, any neurologist, nephrologist, anesthetist, general physician, any other doctor or paramedical person interested to understand and learn about molecular therapeutics can send me a WhatsApp message on the number given here. I will send you the PDF and other scientific data. That number is only for messages and not calls. So ensure that you don't make voice calls. And thank you very much for listening to this talk. I hope you enjoyed listening to this talk as much as I enjoyed delivering it. This talk was given in TOSA, in OSAPCon in Warrangal a couple of days back. That is a conference of the Association of South Indian Orthopedic Associations, and a few glimpses of that are attached after this slide to give you an idea of the oration. Thank you very much for your time and effort. Thank you. And that is ozone. It has a trimodal action, 3 types. Just as our star used to shoot triple arrows, each hitting a different target, ozone also works in 3 different ways, hitting 3 different targets at the same time. It is one of the best antibacterial, meaning it is 16 times more powerful than chlorine bleach,
and 24 times more powerful than hydrogen peroxide. When all antibiotics fail, ozone comes to the rescue.
Kindly bear with the. We'll shortly be starting the OASIS orations.